Hi, I just went and saw our patient. He's a 68-year-old male established with the cardiac clinic. He came in today just for a routine cardiac follow-up, as well as to get a cardiac clearance for his upcoming cataract surgery. He does have an extensive heart history of chest pain, shortness of breath, coronary artery disease, hypertension, diabetes type 2. He is a former smoker, and he had cardiac stents placed earlier this year in March. Today on exam, he does deny chest pain, recently at home as well. He denies shortness of breath, heart palpitations, and dizziness. He does complain of bilateral leg swelling. He denies pain in his legs, and states that the swelling does worsen throughout the day. He also states that his blood pressure at home has been in the 140s to 150s. My physical exam was unremarkable, but his blood pressure was elevated in office today at 143/87, and he did have +1 pitting edema and bilateral extremities. There was, bilateral lower extremities. There was no discoloration, and there was no pain on palpation of his legs. Given the symptoms and my exam, I do suspect that this patient has uncontrolled hypertension. And then I suspect also peripheral artery disease or peripheral vascular disease. In office, his blood pressure was elevated, and the patient complains of elevated blood pressure at home, even though he is taking lisinopril, diltiazem, hydrochlorothiazide, and Coreg daily as prescribed. I'm leaning towards peripheral vascular disease over peripheral artery disease because at this time, his only symptom is swelling in his bilateral extremities. There's no discoloration and there's no pain. Am I correct in these differentials? And then when should I consider heart failure, especially given the patient's cardiac history and his swelling? Today, my plan is I recommend that the patient keep a daily log of his blood pressures and bring it to his next office visit so we can see the data. He also expressed a desire to start hydralazine because that's what his wife is taking, and he feels like he needs to have another medication to help with his blood pressure. I also recommend doing an ankle brachial index as well as a venous duplex to check out his legs and find out where the swelling is. Meanwhile, the patient can wear compression socks. We also discussed a low sodium diet to try to help with that swelling. The patient did agree to put off his cataract surgery. He says that his vision's not affected at this time and is willing to wait until his 3-month follow-up with us to ensure that everything's going well with his heart. And then I would like to learn more about blood pressure medications and when it's appropriate to switch meds or to increase dosing or even to add a new agent. Thank you.